What's up, YouTube? Paramedic Phillips here from Learning to Survive, and today I'm bringing you a class I taught recently on hypothermia. Now, I taught it locally for a small group of outdoor enthusiasts, and believe it or not, it actually started snowing just before we began, so we had to cut it a little short so we didn't get hypothermic ourselves. Now, this was just a basic class, so I didn't go deep into the pathophysiology behind hypothermia, but if you have any questions or want to know more, please comment below. I also left some hyperlinks in the description so you can skip the parts that you already know. Now, before the video is over, please hit that like button, subscribe, and that little bell thingy that makes you get alerts when I post new videos. All right, without further ado, here's the show.
My name's Elizabeth Courier. A lot of you already know me. Some of you don't. I've been teaching outdoor skills for the better part of 30 years. Survival, winter survival, wild edible plants. You name it, we've done it. Now, a lot of you already know I've been pretty sick, so there's a lot of stuff I can't do anymore. So, Tom, come on over here, Tom. Tom Phillips is an nationally recognized and awarded paramedic who's going to be taking over a lot of the medical stuff. He's damn good at what he does. He is attentive, very good with questions. So this part of the class, I'm going to ask you to save your questions until the very end, except during the scenarios where questions are very much needed. The reason we chose a day like this today is because we want you to have a hands-on, realistic experience where you're actually having to see things as they really happen instead of just kind of guessing and play acting. These skills are perishable. So it's important that once you learn these skills, that you practice these skills. Now, I know you two work for the county, for IHSS, so this stuff is really important, right? Especially if you got clients and patients that are in cold homes and stuff like that. This will give you the opportunity to recognize what you're going to experience with these people, and you'll see symptoms that you normally would just not even think about. Okay, especially with the elderly people. All right, with no more ado, I'm going to hand you over to Tom Phillips. Again, save your questions to the end. And enjoy, please. Come on in, Tom.
Hey, Tom. Hi. Hello, everybody. Coming out on this beautiful day here. And what better weather could we ask for to talk about a hypothermia class? So I am going to start off just talking a little bit about hypothermia and why it is something that we should know about. Elizabeth already alluded to the fact that it's a perishable skill and something that we should know. It's definitely not the type of skill that we want to, if we're ever put in the situation where we need to know that information, it's not the time to learn right then and there. Google it, look it up in a book. These are the type of situations where you need to know this information going into it. Now, although I'm standing in the snow right now, a lot of people would typically say in the climate that we live in, it really doesn't get that cold. Do I really need to be that worried about people getting hypothermia? And in the United States, every year, approximately 1,000 people die of hypothermia. And those are not just in inclement weather conditions. We have in Delaware County here multiple cases a year of people getting hypothermia. Just to tell you a little bit about some of the most extreme cases of people actually getting hypothermia and extreme weather cases. This last year, I was in Texas at a training seminar for EMS instructors, and there was a training officer from a base in Kuwait. We had a lot of long talks, but one of them that really opened my eyes to this is he told me about how many patients they bring in from the field, and granted this is Kuwait where temperatures can get into the 120 plus degrees a day, how many patients they would bring in hypothermic in those kind of conditions. So it is not just these, and we'll talk about some of the physiological factors behind that, but it's not just these freezing cold conditions where we would think hypothermia can set in. Hypothermia can set in somebody's house, right? Can set in obviously freezing temperatures, but it can set in warm temperatures too. So we need to know about all of those and how it can really affect them. So without getting too far into it first, I just want to touch on some basics. Has everyone in here kind of taken a basic first aid class before? Know some things? Okay, so we're just going to kind of brush over these. I'll hopefully be able to kind of judge where your level is as I talk about them. But there's no point in jumping right into treating hypothermia if we can't address some of the basics first. I'm sure everybody's kind of heard the phrase, you know, jack of all trades, master of none, right? Well, when it comes to first aid, you really need to kind of know everything, because knowing a lot about a little thing or thinking that you know more than you actually do can actually get you in a lot of trouble sometimes. So even when somebody is severely hypothermic, if we overlook something like their airway or their breathing, making them warm really isn't going to count. So one of the first things, starting off from the very beginning, and would be in any kind of first aid situation, is we need to look at scene safety. Okay? So is the scene safe for us to go into? Now, if we've been hiking with this individual for hours, we can assume that this is a safe scene or whatever has happened we know about. But if we're out here hiking on the trails, possibly come around a turn and just see somebody laying on the ground there, you know, in conditions like this, hypothermia might be pretty high up in our head. But what else could have led them there, right? The endless causes that could have led them to that. Now, this doesn't mean that we're necessarily going to take, 5, 10, 15 minutes to look all around, make sure that everything is 100% safe, but we need to take a moment. I usually like to describe this as a great time to really kind of take a breath. Take it all in, think about what you're going to do and what your next steps are, survey the scene, and see, is there any immediate danger to me, right? Were they just taken down by somebody who's hiding behind a tree? Is there an animal around here? Is there, if you're in a house, is there electrical wires, a gas leak, somebody hiding behind just a simple second to really think, is this safe for me to enter and to help this person? Because as much as we want to help another individual, going into an unsafe scene and making us just another patient isn't going to help them, and it's not going to help any other future responders who show up. So always making sure the scene is safe. The next ones are, as we come up to our patient, we want to assess our ABCs. Right? And these are our medical ABCs, our airway, our breathing, and our circulation. These are things that are quite simple to do, but they're also things that, if missed, can have serious consequences to the patient. If there's any issues with our ABCs, they need to be addressed. They need to be addressed quickly. Even severe hypothermia is going to take a bit of a backseat to some of these. So, what is an easy way to assess if somebody's airway is, as we would say, patent, open, air is able to come in and out?
Try to see them breathing. Either. Sorry, I was just going to say maybe feel around their mouth to see if air is coming out.
Good. So what if we have a conscious person? What's the easy way?
To see if they're breathing. Mask.
So just points about. So as I stand here, is it easy to see if I'm breathing?
Yeah, if you're talking.
I'm talking. There you go.
Oh,
so what's an easy way? I have a habit. And it's something that I would do even when an injury was obvious to me. I would walk up to the patient, and the first thing that I would say is, "Hi, my name's Tom. I'm a paramedic. What's going on today?" Okay? And this would do a couple things for me. This would, one, as soon as words came out of their mouth, I know that they have an open airway, right? But the fact that they're able to produce a sound means that air can enter and exit their lungs. It also tells me a lot about their level of responsiveness. If I'm able to talk to somebody and they're giving me coherent answers back, even very simple ones, it'll let me know a lot, versus if somebody, I ask them a simple question of what's going on, what's your name, right? And they just kind of stare off into space, right? Really quickly, one simple question, couple seconds, and I already know a lot about this patient. So our airway, if we have any issues with our airway, they need to be addressed right away. Now, we're not going to go into all of these, but, a Heimlich maneuver, if there's something in their mouth, we would bring it out. No blind finger sweep anymore, just to quickly talk about some of these things. But if we have an issue with their airway, vomitous secretions in the mouth, we need to roll them over, get those out of there. Any issue with an airway needs to be taken care of. EMS, the saying is, no airway, no patient. And it's true. No matter how severe their injuries are, if we have no airway, if air isn't able to enter and exit their body, we have a big problem there. So it's something that needs to be taken care of. Our next one is going to be our B, our breathing. So at this point, we're not getting respiratory rate. We're not necessarily looking for adequate oxygenation and some really in-depth things. We're looking to see, are they breathing? Are they breathing? Is it fast? Is it slow? Right? Is it able to sustain their body? So what's an easy way to do that? Similar to how I did before. Just looking at them, right? Hey, looking at chest rise and fall is something that's usually pretty difficult, especially in cold conditions like this where people are typically very bundled up, right? Trying to see chest rise, the adequacy, how large or small my breasts are going to be really hard to see in a big puffy jacket.
But you can see the condensation in air as it comes out of your mouth.
It's a great example. Condensation coming out of their mouth. Right? Just as their body moves, I can see by looking at all of you right now, I could probably guess what your respiratory rate is just from experience. However, it'd be really hard for me to look at your chest and actually see that chest rise come in and out. Come on, everybody, just kind of take a second. Look at everybody else in the group here. Okay? Just look at one other person, and I want you to look at how everybody is breathing. This is something that it's not a normal thing to look at other people and see how they're breathing. But I want you to take just a second and kind of do it right now. Okay. Again, these are skills you don't want to be put on spot the first time you ever have to check to see if somebody is breathing. I've never really looked at that before. So we take a second here, actually look and see. So what do you see as you look at somebody? Right? What? Chest rise.
And you can see through their nostrils if they're breathing.
Nostril, we call it nostril flares. Yeah, if their nostrils are moving. You know, you can just look at somebody, and even if you haven't actually done it before, you can typically tell if somebody is standing up here and I'm right, or really kind of bent over, you can just see that distress. Maybe you don't know what is going on, but you know that there is something that's leading to me having some difficulty breathing. Okay? Now, what about really slow respirations, right? It might be really hard to see those slow respirations. You're not going to see that nasal flaring. You're not going to see my mouth pursed and trying to suck air in and out. And it'd be really hard to see my chest moving. So what's a really easy way to see if somebody is breathing, right, when they're wearing a lot of clothing and in cold conditions?
Put your ear down.
Pretty loud right now.
True. Yeah. That's what I
Good, but my hands, I don't have gloves for some reason, crazy reason. My hands are almost kind of going numb now, so it'd be probably pretty hard to do that. Again, you can try. You can do the mirror under their nose. You can look at condensation coming out. Typically what I teach, the simplest thing, right? We always just want to keep this simple. Put your hand on their chest. So even if you can't see it, what does your chest do if you're breathing? It moves. Right? In and out, up and down, their chest is moving. And you can feel it even if it is through layers of clothing. So one of the simplest things to see if somebody is breathing when you're not sure, when you think they're not, right, would be just to simply put your hand on their chest. So now so we've learned A for airway, B for breathing, and now we're on to C, circulation. Okay? And circulation is not just pulse, do they have a heartbeat, right? But what's the adequacy of their circulation? So some of the things that now we haven't even really got in depth into assessing our patient, but just by looking at somebody, what's some ways that we can see what kind of circulation they have? Color of the skin. Color of the skin's a very good one. And we're going to talk a lot about how cold can affect the color of your skin today. But one of them is as blood pumps around, right, as it comes up and it perfuses your skin here, it gives it that pinkish color. It gives it that hue. So we can see by the color of somebody's skin how well perfused they are. In hot conditions or when you're running around, when you're exercising, when your heart rate is very high, your skin becomes very red, right? Very flushed. Blood comes close to the skin to release heat, but also as that blood pressure rises, right, we're pumping more blood to the skin. In cold conditions like this, we try and shunt all that blood into the core so we look a little more pale. Now, what about checking a pulse? Everyone here, anyone ever actually checked a pulse before? No. Okay. So there are a lot of different places to check a pulse. Today, we're going to focus on two and only two. So we'll talk a little bit more about why this is our primary one later, but the primary one that I want you to focus on is taking a radial pulse. So right here on the side of our wrist, Right? You're just going to slide right over and you'll fall into a little groove right there. And you'll be able to feel a pulse. And what I want each of you to do is just turn over to your partner, and I want you to try and feel a pulse on your partner. Granted, we're all alive. We all have pulses, so I know it's there. It's a hard thing to find sometimes.
I had fun time running on.
So some things that you should play around with is not only position, but how hard you push. It's easy to, sorry, hailed a bunch of smoke. It's easy to push down so hard that you can actually occlude that artery there and the blood doesn't travel through it.
I can barely feel it.
Oh, yeah.
It's not right in the middle, it's right here on the side. Oh, here we go. See, there you go. She's alive. Yeah, congratulations. Okay, she's alive. That's the key thing. Oh my God. Okay.
Okay, so our next one, if we cannot feel a radial pulse, the next place that we go to is a carotid pulse. You go right in through your trachea here, right on the men where their Adam's apple would be. Just slide over to the side closest to you. It'll fall down into a groove, and you'll be able to feel a carotid pulse there. As long as everybody's comfortable with it, I'd like you to check that on your partner also. And I'm kind of slowly getting you into this here, but we need to get used to touching people.
Dead. There it is. Yeah, dead now.
Into it. So the next one that we want to check on circulation would be any severe bleeding. Now, this is not cuts, scrapes, bumps, bruises, anything like that. This is where we would address any kind of large bleed. Now, I've been talking about this for 5 or 10 minutes now, quite a while, but these happen within a couple seconds. I quickly look at your airway, I quickly look at your breathing, and I quickly assess your circulation. If you have any severe bleeding that needs to be taken care of, this is exactly when I would do it. I wouldn't go any further on. If you have, say, a severe femoral bleed going on where you can bleed out within a couple minutes, it needs to be addressed right then and there. I don't continue on for the rest of my assessment. So any kind of large bleeding will take place, controlling it would take place right now. So these are our ABCs, and this is something that we do on every patient. Again, it doesn't always take very long. It doesn't always actually even have you actually touching the person, but it's something that you always need to keep in the back of your mind. You always need to assess before moving on to anything else. So the next now is we're going to be talking about hypothermia. I'm staying in water here. We're going to be talking about hypothermia, but the basis of all this, I can teach you all these skills about hypothermia and how to address that, but if we don't know some basic skills about patient assessment, if you can't actually discern what's going on with the patient, how much you know about hypothermia isn't going to help you. So our next ones here, and this is a quick kind of down and dirty on a patient assessment, is we need to talk to them and figure out what we can assess from them. This is where we get to play detective. Right? On medical patients, it's a lot more difficult. On trauma is what gets most people into EMS. I can definitely tell you, it got my heart pumping and blood flowing when I was on a really traumatic call. But what I really love about EMS were the medical ones. They're not as exciting. They're not the gunshots or the stabbings or broken bones or all this, but they're the ones that really make you think, because it's not obvious what's going on. Sometimes we might find that we think it's one thing. We think that the patient's hypothermic because they're laying in the snow, but maybe they're actually hypoglycemic. They're diabetic, right? Just because somebody, is laying in the snow doesn't also mean that they didn't have a heart attack or a stroke or having some other kind of symptoms, a seizure, list can go on. So we need to have kind of a wide angle lens as we look at our patient here and think of all the possibilities that could have happened. So as we come up to our patient, we are looking at their ABCs. We're also taking in everything else. What do we think has led them to this situation? Our best source of information is going to come from the patient. So asking them, how do they feel? What what were they doing that brought them to this? If we're able to discern any kind of medical information, be very important from them at this point. If we're unable to get information from them, then we need to kind of try and get our own. So this is where we would do a head-to-toe assessment, as we say. So this is where we need to be able to touch our patients, right? We're trying to save their life. We're trying to do it, so we can't be afraid to not touch them. And it's not, does this hurt? How does this feel? It's you got to get in there and you got to really touch them. If you have a patient who's semi-conscious, they're laying on the ground and you don't know how they got there and you just came around to turn, we don't know if they got hit over the head, tree branch fell and hit them on the back of their head, or if they're a diabetic, or if they're hypothermic, or what. So the only way is now we have to start trying to figure out what led them to this situation. So we're going to start off in a methodical way at their head, palpating across their head, looking at their face, looking and feeling as we go, on their neck, across their shoulders, chest, abdomen, groin, pelvis, legs, arms, and we're looking everywhere for any kind of evidence. We're looking for evidence of injury. We're looking for evidence of maybe medical alert jewelry that they wear, something to give us some sort of an idea of what's going on. If there's other people there with them, try and get some information from them. Even if this information that we gather doesn't mean anything to us, or the medical alert jewelry that they're wearing says they have some sort of disease that we have no clue what it is, gathering this information is going to help future responders. There were definitely a lot of patients that I had that would tell me cancer was one of the big ones. There's a lot of different kinds of cancer out there. So they would tell me what kind of cancer they have and what kind of medications, and I really did not understand all that. But I would take that information, gather it, and I would pass it on to the nurse or to the doctor, and it would give them that many steps ahead on discerning what's going on with the patient. So we're gathering information at this point. Even things that we think might not be relevant, we gather all of it because it's going to help in the larger picture of figuring out what's going on with our patient here. So again, this was just kind of a quick down and dirty. We're going to make sure the scene is safe, make sure our ABCs are intact, and we're doing a patient assessment. We need to figure out what's going on with our patient before we jump to any conclusions. Make sure that it's not just one thing, right? Patients can have multiple symptoms going on. It's actually not uncommon for somebody to be hypoglycemic and hypothermic, right? As your body fights things off, you burn a lot of sugar, to have other things going on. So that's what we're going to start talking about now. We're going to really kind of get into our lecture topic here, which is hypothermia. So hypothermia is low temperature. I'm starting to get a little cold myself. So stage 1 hypothermia here is if you were to look at it in a book or read it in a medical journal, they usually like to give it a temperature, which is somewhere between 97 down to 90 degrees. Today, what I'm teaching you guys, I don't want you to worry about the actual temperature ranges at all. Actually, I'll tell you, stage 1 is from 90 to 97 degrees, stage 2 is from 82 to 90 degrees, and then stage 3 is anything below 82 degrees. They also talk about it in Celsius, but we don't use that. That's core body temperature, all right? And that's the important thing there. That's core body temperature. Anybody know how to get a core body temperature on somebody?
Anally?
What's that?
Anally?
We say rectally, but so a rectal temperature, right? So beyond that, I mean, there's other ways in ICUs where they can do surgical implanted catheters, central venous arterial catheters, but we're definitely not carrying around those. And you're also probably not going to be checking a rectal temp on anybody out in the field. So what their temperature is doesn't matter, right? They're cold. Hey, it's not going to change our treatment modalities at all to know if they're 88 degrees or 92 degrees. So I'm not going to talk about degrees anymore, which is what you would hear a lot in a very typical hypothermic class. They would start talking about what temperature they are, and that is going to define what stage. What
any 92 degrees, is that just as deadly as like 88 degrees, or it doesn't matter for your
the temperature alone isn't going to have as much as an important fact as some other patient demographics. So 92 degrees for a 70-year-old male with a cardiac history could be just as deadly as 88 degrees for a 25-year-old healthy male. Right? other things that can come into it is, how long have they been out there? How long have they been exposed, right? How dehydrated are they? How nourished or unnourished they are? So a lot of other factors can come into play there. And the temperature itself, getting a reliable temperature isn't going to be very achievable. And then in the field, what I want you to do is I want you to be treating what you're seeing in front of you and the signs and symptoms that they're showing you, not looking at a thermometer and saying, well, it says he's at 88, so I should do this. Even though he looks like he's in, or it says 92, it looks like he's in stage 2, but the temperature says he's only in stage 1, so I'm only going to treat him like he's stage 1. That's why we're just going to throw that out the window. I'm just going to show you exactly what to do for patients as they show you. So stage 1 is something that we've all probably been in, actually. Believe it or not, we can all raise our hands. We've all probably at some point been in stage 1 hypothermia, right? Hopefully it's not going to happen today, but it's something that happens to us as our body temperature lowers, as we get exposed out to the elements. So talk just a little bit about how does our body regulate temperature, right? How can I be standing out here in what is obviously freezing temperatures and my core body temperature is still at 98.6? How can I be in 120 degree weather and my internal temperature still be at 98.6? So inside of our brain, in our brainstem, we have our hypothalamus. Our hypothalamus, amongst other things, is a center that regulates our core body temperature, right? And it does that by moving our blood around. To think of our body as like a radiator in a car or old one in our house. As the blood circulates around, it warms our body. As it comes closer to the skin, right, through radiation, we radiate some of that heat off. You can also lose it through other things like respiration. As we blow off heat energy, we bring in cold air also, or through evaporation. As our skin gets wet and the water evaporates, it can pull temperature away. So our body regulates this by moving our blood around. As we get cold, like we talked about before in circulation, our body starts to shunt our blood. And it shunts it by vasoconstriction, by constricting down the vessels in our peripheries and out close to our skin and pushing it in closer to the core. Our body is incredibly smart. It knows what has to be done to keep us alive. It knows when we're getting too hot, we need to put off a lot of energy. It knows when we're getting too cold, we need to hold a lot in. So stage 1 is we're still compensating for a lot of this heat, just like we are now. And we start doing a few things. 1, our body starts shunting some of that blood into the core. We also start, what do we do when we get cold? We shiver. Why do we shiver? Keep ourselves warm. What's one of the ways that our body produces heat energy is by movement. As our muscles move around, they create energy. That energy is transferred into heat, and it helps warm our body. What about some other things? Some goosebumps. It's kind of hard to see on me. What's the purpose of goosebumps?
Well, if you were a cat or something, the purpose would be to fluff up your fur so that it provides.
Yeah.
So we're not cats. We don't have fur.
Well, we don't have fur, but our bodies are covered with hair.
Yeah.
So at the base of our hair on our body here is they're called erecti pili muscles, right? And they hold our hair up. Right? Fancy little term, yeah. They hold our hair up. When our hair is sticking straight up, it actually holds in heat better than when it's laying down. So when we get cold, we get goosebumps, and that's those muscles at the bottom of our hairs there contracting down to hold our hair up. And as our hair stands up, it traps more heat.
How do you know that's an evolutionary? I never knew that.
Yeah. So again, it's just talking about some simple things here. We would expect somebody who's cold, they start shivering, right? We'd expect them to have goosebumps, right? Our heart starts escalating a little bit as we need to move blood around to get more warmth. So in early stage 1 hypothermia, what we're going to start seeing is we're going to start seeing somebody who is shivering. We're going to start seeing goosebumps on their arms here to help hold in some of that heat. And we would expect at this point a slightly elevated heart rate. And we would expect with that elevated heart rate a slightly elevated respiratory rate. We're not going to get into numbers. It looks faster than it should be. But what also goes along with some of this is we start getting a little bit of confusion. And that confusion is similar, hypothermia is very similar to shock in a lot of ways. There's a lot of different types of shock, the pathophysiology in shock. We can have an 8-hour lecture on that alone. But what starts to happen, or the definition of shock, is going to be a decrease in perfusion. So as we get cold, as our body starts shunting that blood, as things start slowing down, blood isn't flowing around as good as it was before. What uses up more blood in our body than anything else? What uses up more energy? Our blood brings energy to everything. It can be our brain, right? It uses up more energy than anything else. So it is the first thing to suffer due to lack of perfusion, lack of blood flow. Now, stage 1 hypothermia is, I like to equate a lot of these kind of levels of shock or hypothermia to somebody who is slightly intoxicated, right? My wife asked me earlier, how would somebody in stage 3 hypothermia act? Well, she's never seen anybody in stage 3 hypothermia, but she's seen people who are severely inebriated due to some sort of substance. And unfortunately, we've probably all seen people at those levels. So stage 1 is usually somebody who's had a couple drinks. You can say something's a little off on them, right? But they're not severely intoxicated, right? As we go down that list, it gets worse and worse. So the scenario that we're going to kind of talk about here in our class that we'll just use through all these stages is group of people here. We're out on a hike. Okay, we've been hiking for an hour or two. We kind of know each other a bit, but we don't have in-depth medical knowledge of each other. However, we've been walking with so-and-so, and we're cold, we're shivering, but now we've been having this conversation with them, and slowly they're not quite answering us as quickly anymore. We can see that they're starting to act a little sluggish. We look back at them, and the coordination is a little off. It comes to motor skills. One of the first things that goes with motor skills are our fine motor skills. Now we have fine motor skills like this. This is a very good test that I usually like to have people do when they get cold. Just touching your fingertips together. Okay. Then we have gross motor skills, standing, walking, things like that. Fine motor skills go a little bit earlier. In stage 1 and kind of going into stage 2, we can start seeing some loss of maybe some fine motor skills as things get really stiff, right? And it starts to we don't have as good of neurological signals anymore. So stage 1, we're going to start losing some of these. So we have this person who's behind us, and they're starting to kind of not answer questions as quickly anymore. They're, maybe wandering around a little bit, right? And we can see that they're shivering, but they're not quite acting right. Okay. Now we know that we're assuming, based off of some of these things, that their core body temperature has lowered down a little bit. Okay. How's everybody doing? Are we starting to feel kind of cold?
Yeah.
Okay. So what's one of the ways that we warm ourselves up? By moving around. So let's take 5 minutes and let's get up. You can get a little close to the fire, but let's walk around a little bit, kind of get some muscles going, some energy out of that. Okay, so we'll get started back up here just for a couple minutes. So we just talked about what some of the signs and symptoms of stage 1 hypothermia are. Okay? So now we need to talk about what do we do when we see somebody exhibiting those kinds of symptoms. Okay? What do you think the first thing we should do is? Okay.
And if they're wet or not.
And if they're wet or not, right? We have a lot of. The first thing that we want to do is try and remove them from that cold environment. Yeah. Now, a lot of situational things can come into play here, right? If you're simply just outside of your house, been outside, it's cold, it's working, you didn't want to stop, even though your wife told you to come inside. Well, you should probably just go inside. Right?
Mommy's always right.
If you're 10 miles out into the wilderness, you're going to have a lot of different kind of factors coming into play there, right? If this is somebody who can still walk just fine themselves, right? This is somebody who's wet, it's not. So we'll talk about some of the answers that I can give you here. We'll try not to get too much into all the what if ones, but I'll just kind of give you an overview of what you want to do.
Oh,
so the first...
Cell phone, I'm sorry.
It's all right. The first thing we want to do is try and get the person out of that cold environment, okay? Right. If that is an option, if it could be as simple as just getting into a vehicle, and we want to, at this point, just do passive rewarming. Passive rewarming versus active rewarming. Passive rewarming is putting on a jacket, right? an extra layer of clothes. Active rewarming is having hot air blow on them, putting hot packs in underneath their armpits or in their groin, drinking warm fluids.
Yeah, see, I would have never thought of that either. Putting hot pack, using hot packs.
Yeah.
Great idea.
So right now we're just doing passive rewarming. We want to, whatever kind of wet clothes are on them, removing the wet clothes, putting dry clothes on them. Okay, comforting them. One of the biggest things that with any patient, whatever severity is at this point, something is going wrong with them and they're not sure exactly what it is, or they're scared because they think they do. Okay? So one of the biggest things that I did as a paramedic is I just talked to patients. I talked to them. I didn't necessarily lie to them, say, don't worry, everything's going to be okay. There's nothing wrong with you. But you would reassure them, right? Help is on the way. Okay, it's all right. You're going to be okay. We're going to help you. Don't worry. Hey, and just talking to them, calming them down, because in stressful situations, right, as your heart rate elevates, you start breathing faster, everything kind of just goes downhill from there. So in a situation like this, you want to have one person who's clearly in the lead. We don't want 4 different people trying to do 4 different things. What would be a great point here is one person, and it can be a pre-designated or not, whoever's usually, if somebody hasn't been pre-designated as the medical person on this hike, whoever noticed that something is wrong with the patient, right? Because clearly they have an eye for what's going on. Right. So they kind of take charge. They're the one who's now talking to the patient and not giving orders, but kind of directing everybody so we have a clear plan on what's going on. As I am getting down, I start talking to the patient. I would ask you, if we're out in the woods here, why don't you start building a fire, right? So-and-so, why don't you get your sleeping bag out, some warm clothes. Let's get these wet clothes off. You get those ready. Somebody else, if we're far away, why don't you see if we have a cell signal and some radio service, because we want to try and figure out a plan here. As I've said before, when we first started out, we all raised our hands, or I told you to anyway. We've all probably been in, stage 1 hypothermia, right? It's not really that big of a deal. It's completely reversible, and it happens all the time. However, the difference between going into stage 1 and stage 2 can be as little as a few minutes sometimes. And the big difference between stage 1 and stage 2 is the actions that we take to reverse it. So it is completely reversible, but we have to do things in order to reverse it. Our body is compensating at this point, but it's only going to compensate for so long. So the actions that we do need to be pretty direct, and we need to start thinking about plans for down the road. Hey, how does everybody feel about that? Any questions? Okay, so we're going to do a scenario here in a minute, right? I'll give you guys just a couple minutes to talk amongst yourselves, kind of get some blood flowing, and as soon as you're ready, we're going to step on over here and we have a scenario, right? I'm sure you can probably guess what it's on, but I don't want to give it away.
Yeah.
Okay, so we'll just kind of start from the beginning on that scenario. Oh, first off, overall, you guys did fine. You did pretty much exactly how I would expected you to. Right, we throw you into those situations and we do these live kind of things like that because as you actually go through these experiences, you see all the little mishaps that happen, and those learning experiences, those are things that I can't give you just talking about it in a class, right? Sure. Actually being out here in snowy, wet weather and actually having to cook and heat up.
You okay? Yeah, maybe we should move this plank.
Those are experiences that are, Yeah. So from the very beginning, who was it who ran up to Elizabeth?
Me.
Okay. So my takeaway from that is obviously Elizabeth, but we were kind of pretending here, and this was just a random person walking out of the woods. If this person that's a safety issue, right? We don't know she might pull a knife on you, pull a gun. She doesn't know you,
That's
right?
True.
Maybe we are thinking that she was hypothermic and a little disoriented, but should you be running up and scaring somebody in that situation?
No.
She might have, ran at you or turned around and ran away. We're not sure how they're going to react at that.
That's
so
true.
how we approach these kind of people, is very important. Kind of sets the stage for the rest of it.
Right.
Okay? Who was in charge of that scenario?
I guess, I don't know. You were, because you're the one that ran up to her. No.
Yeah, so, it doesn't have to be the first person who makes contact.
It was actually her because she went straight over to the backpack and started taking the initiative of.
So I think the takeaway point from this is there wasn't a clear person who was in charge,
Gotcha.
right? We kind of weren't quite sure. And not only does that cause a little bit of disarray between the team, because the
Right.
team isn't quite sure who's in charge,
Right.
there was actually a couple points there where the patient was getting questions kind of fired from this direction and that direction, and wait, who do I answer? What's going on here? Again, we already have a patient that's a little confused. Now you have 2, 3, 4 people asking her different questions. It can get a little out of control at that point.
Gotcha.
Hey, we had a couple people talking about fire. That was a really great idea. We didn't maybe set the stage so great to say that, well, there isn't actually a campfire over there. The fact that you were thinking it is what we want you to do. What I would prefer in that situation is that clear leader say, okay, hey, let somebody start a fire. Okay, we didn't really give you the scenario of how far away you are either. I mean, we were in this exact setting and somebody just wandered out of the woods, somewhat hypothermic right now, the best thing to do is we'd put them in our car. If we needed to go somewhere, we could.
The stove sitting there, they see that there is a source of heat and a way to get hot fluids in a person. So that's part of that. But anyway.
Yeah.
So the next one is we look at her and she's wet. Right? Now, do we want to just, strip down her clothes? Do we have anything else to put on her?
We need to see if there is something. Yeah, we need to look for blankets or anything that we've got.
Yeah, so this is where the scenario kind of starts playing out. And these are also things that you can think of in your head going forward, And next time you're packing to go out somewhere, are you going to bring an extra change of clothes, right? Or do those change of clothes?
Say that again.
Are those change of clothes going to fit, anyone? We should probably have large clothes, right? Large clothes typically fit a lot more people. So, starting to kind of think of those kind of things as we pack to go out. What kind of things should we bring with us?
So anyway,
everything.
Yeah.
Let's kind of recap. Like Tom is saying, you notice first. So you take the lead.
Okay.
You say, Gail, okay, you get some hot fluids going. You get some clothing on. Distribute.
Gotcha.
Take them in, and then we'll find a smoothness in the situation. Because remember, hypothermia phase 1 can become what? And how fast?
It can be phase 2 in a couple of minutes. It's a very, very progressive. And at this point, the only thing that's going to change going from stage 1 to stage 2 is our actions and how we intervene on the patient. Okay?
So let's do a self-assess. We'll take Gail. Did the patient come out of this stage 1 scenario? Okay. Okay. So this will be a little bit more realistic. Now, what could have happened with the patient? What was all happening? How did you know she was okay?
I checked her pulse for one and her breathing, and she was talking. She was talking and alert and answering.
So in the end, you were confident that she had warmed up enough to have reversed out of it.
I think so.
Okay.
Maybe used a lot more hot liquid, but
right. In reality, you want to make sure that you
maybe stay in that little tent a little longer.
Yeah.
So when we'll go back to the questioning, I think it was you who was asking a lot of the questions. Do you know who I am? Do you know who you are? Do you know where you're at?
Right.
Yeah. And so we call those A and O questions, alert and oriented. Alert and oriented times 4, nurses use times 3. Those are questions that we get kind of deeper into their level, right? There's a long list of them that we're going to go through, a GCS scenario, a Glasgow Coma Scale. Right. We can really get into those. But again, we're just keeping it simple at this level. Was she disoriented or not? And she was. So asking more questions and trying to figure out those, what ultimately it's going to do, 1, it's going to waste time because we need to act quickly. And 2, we're really just kind of confusing our patient more. We need to know what's going on quickly and so that we can act appropriately. Knowing that she's disoriented is good enough. How disoriented isn't really going to change what's going on here. We're looking at the signs and symptoms of what's going on. Disoriented, good enough. Check that box, move on to the next.
Slightly agitated, that's always a good sign.
Yeah. So now we'll go back to talking to the patient. And yes, I do agree the first person who comes up to the patient, good person to take charge. Now, if it just so happens to be that, you're the first one in the trail, you make contact with them, but somebody else in the group is more equipped to run, you can pass it off, but we just need to have a clear leader and a clear designation of, okay, I'm no longer the lead, you're taking the lead, go ahead and take it. Now that person is not only directing everyone else, they're the person who's talking to the patient, and they're that main communication point. So what I also saw is once you guys got her wrapped up in the sleeping bag and got her out of the elements by putting the tarp over her, which was a great idea, all four of you then kind of concentrated on, let's heat up the water, what's the honey and for, and she's just kind of sitting in there all by herself. What's going on, right? There was nobody there reassuring her, talking to her, assessing, is she getting better or is she getting worse? Is this helping or is this not, right? And we don't need to be asking necessarily questions of, who are you? Do you know where you are? To know, is her, confusion level, is it getting better or worse? Just have a conversation with her. Right? And you can.
She was like twice.
Yeah.
I get confused
Now,
when I get put on the spot.
nobody feel bad about this
Oh no,
because
this is learning.
failure is the most important way you can learn in a situation like this.
Absolutely.
I was very happy with how that whole scenario played out, because I think all the points that didn't go well, I expected them to, and now those are experiences that you can take. There were key points that we can talk about, we can do differently in the future. Now, some questions that were brought up that I'll answer, and I'm moving things along a lot quicker here just because of weather and everything. As they happen in scenarios, I want to bring them up. So, why was the sugar and the lemon? Why are those important things to put in a drink?
Well,
So,
I got the
honey. So sugar, right? As we shiver, as we use up our muscles, right, what does our body use to make energy? Sugar. All right, we'll just keep it simple, right? We use simple carbohydrates. Actually, we'll do it that way.
Sugar and the lemon juice and the honey.
Right.
Sugar and then there's sugar and the lemon juice too.
So we can use a fire analogy. Okay, as our body breaks down sugar, it produces heat.
Right.
As Elizabeth was starting the fire, what kind of sugars, wood, did she use? Little wood, right? Now, for a long period of time, for it to burn for a long period of time, we want big pieces of wood, but to get it started and to burn really fast, we want little pieces of wood. So we want little, simple sugars that we can drink and ingest very quickly. We also want that warm fluid to not only help warm up our core body temperature, but warm fluids are going to be digested and put into our circulatory system faster than cold fluids are. As we drink cold fluids, those fluids now not only cool down our body, but have to be brought up to body temperature, utilizing energy. But you have to be brought up to body temperature before they'll be distributed out into our circulatory system. So we want to give them hot fluids to warm them up, but it's also going to increase the time that it gets into their circulatory system.
An important note is to don't boil the water, because that can also shock the system. You want it warm enough where you know it's going to elevate the core temperature, but not hot enough to shock her.
I know that. Like 120 degrees. Remember how to use it.
So the next one, lemon, right? The lemon juice, right? Electrolytes, right? And without getting too far into how electrolytes help out our body,
I
right?
took a nutrition class too.
Somebody who's been out, one, hiking, right? Two, hypothermic, so they're using up a lot of energy.
Right.
And three, something that our body does when we become really cold. If you've never noticed, when you become cold, you actually produce more urine than when you're not cold. All right, there's a couple different reasons behind this, but the one kind of simple reason that we'll talk about is as your body forces all that blood into the core, it raises your core blood pressure, and so it kind of forces more blood to flow through your kidneys. The pressure gradient changes, and your body and your bladder fills up, so you urinate more, right? Helping you to become more dehydrated quicker.
Gotcha.
So, electrolytes and sugars into their body quickly. Now, eventually, we want to give them more, complex carbohydrates, whole grains, and larger food to help for that long-term fire. But to heat them up quick, we want to throw a bunch of kindling on that fire, give them a bunch of sugars that their body burns off really quick and helps raise that internal temperature. Okay.
That is so cool. Thank you.
Yeah.
I appreciate this.
And what's funny is when you put it in a real world situation, you suddenly realize even though you think you know stuff, it can become a mess real fast.
Yeah, exactly.
It is. I related it.
Come on, Tom, you're making us cold. Come on.
I always related it, to EMS, but first aid overall is a really interesting thing because it takes not only the classroom knowledge, but the practical application.
Right.
I've known a lot of people who were, incredibly intelligent, who I went to paramedic school with, but then when it came to the practical use of it, they couldn't do it. They'd blank out. They could get 100% on a test, right? But then when it came to actually assessing a patient or touching them or that critical thinking, they were horrible at it. And then I've seen people, the other spectrum too. They're not that good at a test, but man, you put them on a patient and they take great care of them.
Yeah.
So, it's putting both of these together, and that's why it's so important for me to be over here and talking to you and telling you all this stuff, but you got to get out there and actually do it and actually use these skills so you can figure out how what I taught you in the class can apply to real life. You guys want to take a break for a couple minutes and just kind of move around, and then we'll start talking about stage 2, or do a quick rundown of that. We'll go through a scenario. We'll talk about. That's kind of how we're going to move.
What if you're by yourself? Like, what if you're by yourself and you think you're getting hypothermia?
Yeah.
Well, then in that case, if you think you're getting hypothermia, obviously you're conscious enough to think through it.
Right.
You act on it.
Right. So you need to find this.
Don't think, well, I'm going to keep going. I can
sure.
push it. Time and time again in Yosemite during the wintertime, I've seen people do that, go in by themselves, and the next thing you know, they've jumped from phase 1 into phase 3.
Yeah.
Right, so if you think I'm getting kind of cold, it's starting to shiver, you stop. You got hot fluids in you, change your clothes, get dry clothing on if you can.
Right.
All right, and then assess your situation.
Right.
But yeah, just if you're by yourself. Now, ideally, you should not be by yourself.
Yeah.
Teams of 2 or 3 in the field, and always let people know where you're at.
And I always carry a little. Anytime I walk anywhere, I get a rock that fits in my hand, perfect size for protection. But I got my little thermos that I carry hot chocolate in. Something warm to drink, hot tea or something like that.
Anyway,
so
Tom, go ahead, dive in for stage 2.
Oh, go for it.
And I'm going to go get everything fixed. All right. So, enjoy, guys. Tom, get in the
Will do.
Yeah.
My next victim.
Okay, I gotta stand on the other side. Okay, so stage 1 we talked about. Stage 1 is completely reversible, and in the overall scheme of things, really, they just got too cold, right? Not very serious. We're not going to have any lasting consequences of it. It's something that even if you are by yourself, through just by some preventable measures, you'll be able to get out of. Stage 2, which is just a couple minutes away from stage 1, so this isn't a giant leap. This is really just another step.
Right.
Can happen very quickly. Okay? And although it is reversible, it is definitely something that's going to take a lot of outside measures to go ahead and do. So in stage 1, we were compensating for that cold. We were becoming colder than we should, right? We were starting to get a little confused, but we were compensating. Our body, we were shivering, right? We had our hair standing up with the goosebumps. We were starting to, our heart was going a little bit faster. We were breathing a little bit faster, trying to get that blood flowing. But in stage 2, a lot of our compensatory mechanisms start to fail, right? In stage 2, you can either be shaking very violently, right? Or now you actually stop shaking at all. Typically, it depends on what book you read, but typically stage 2 is classified as you're no longer shaking anymore. You're no longer compensating for feeling that cold. The amount of, you're starting to become very confused, lethargic, gross motor skills are almost completely gone. Your ability to walk and move, your gross motor skills are now starting to be affected. This is where people with pre-existing conditions, pre-existing heart conditions, pre-existing endocrine issues such as diabetes, the old, the young, right? Pacemaker wouldn't come into play with this. It's not going to be affected necessarily by the cold. It would actually probably help a patient in this area. Instead of now our heart and our respiratory rate being elevated, our heart and our respiratory rate actually start to slow somewhat significantly. So before, when we had our patient, I talked to you about checking for a radial pulse.
Right.
I'm having you check for a radial pulse, not only to see if there's one, there, and obviously if somebody's walking around, they have a pulse, but I like checking for a radial pulse because we can see it helps us really determine peripheral blood pressure. So in trauma, what we do is instead of taking the time on the side of the road when somebody's just been in a massive car accident or something, we'll check for a radial pulse. If somebody has a radial pulse, can be discerned that their systolic, that top blood pressure, is somewhere between 80 to 90. Okay? If they don't have a radial pulse, but they're talking, so we know they're alive, then we know that their blood pressure is low. And that is good enough for any kind of scenario like this.
Gotcha.
So, radial pulse, blood pressure good, no radial pulse, blood pressure bad. Right? Simple as that. Now, if we're not sure if the patient is alive, then we move to our next one, which is the carotid, and now we start, determining if we're going to do CPR or not. But for knowing if blood pressure is good or bad, it's just radial pulse. If it's there, it's good. If it's not, it's bad. Okay? So if we know that now we have a patient who is severely confused, they're no longer shaking, and they clearly should be shaking because it's cold.
Right.
Okay? They're not breathing very fast, which we would assume somebody to be breathing very fast because that's how your body compensates. Your heart starts pumping faster to move that blood around. You start breathing faster, but they're breathing really slow. Well, that's not normal. Right? And we go to feel a radial pulse, and we feel it, and it's very slow, which it shouldn't be. It should be fast. Or it's not there at all. We do not have good perfusion. Okay? There's some other things that we can look at, such as cap refill, to see how, and that's as we push down on our skin. See how it takes a long time for that skin to pink back up?
Forgot about that.
It's something that can be used, and so does everybody understand that. As I push down on my skin in normal conditions, when I would let up, it would be pink really quick again, right? I'm pushing the blood away from my skin, right? And as I let go, it comes back to it. You can see now, because I'm very cold, right? It takes a long time. It's actually still a little white right there. These are not only environmental things can change this around, but pre-existing circulatory issues can. So I don't like to use it that much because there's just so many factors that can come into play there. Again, if you just want to check it and you can see, you're not sure they're cold for some reason, you can see now that I clearly am. However, this isn't going to change really much of what I'm going to do.
I was going to say, is it kind of like, would it be like a waste of time in this situation for some she's got a really slow radial pulse or no pulse at all. I mean, she's obviously cold enough to where she's not getting, her blood pressure really low.
Sorry.
Really quick.
It is something that would not at all change my initial treatment for this patient. However, ongoing assessment of them, I would be checking that, right? Am I checking, are they warming up or are they not? Because a couple minutes ago when I did this, it took 30 seconds to get pink. Now when I did it, now it's taking, 5-10 seconds. So we're improving. It's a good way to judge that. Initially, is it going to change my treatment? No, right? They're cold. I can tell they're cold. I can pretty much expect what their skin's going to do.
Right. When's the next one?
You can probably go over, get ready now. Okay, so in stage 2, we need to start taking some more, not necessarily invasive, but we're moving away from that passive rewarming to a lot of active rewarming. Right? We need to do the same things as we did in stage 1, right? We need to get them out of those wet clothes into some dry ones, right? We need to keep them from getting, wet in the future. We need to start making a fire. We also, just like as from stage 1 to stage 2 can take a couple minutes, stage 2 to stage 3 can also be very quick. So we need to know and take a quick, assess our surroundings. How quick can we get this person out of here? Okay, if we can get them out of here quickly, we need to work on doing that. If we can't, we're staying in place, we're starting a fire, we're starting to get a hold of whoever we can to come and rescue us and trying to figure out where we are. Right? If that means we don't have cell service for radio right where we are, we need to send somebody to as quickly as possible, get somebody to come, because we have a patient who could, if we're not able to reverse this quickly, become very serious and possibly life-threatening.
So the whole group could become hypothermic?
Yeah. The whole group could become hypothermic. So you need to be taking a lot of actions and a lot of actions very quickly, right? Any questions about stage 2?
Right, why don't we set the scenario forward?
Sounds good.
Okay. You're going to find a person whose camp is disheveled, not organized, shelter's not up. You're going to find a situation that she's not able to do things with herself. Okay. You're going to see the basic tools that you need there. All right. Again, what you learned from the previous one, utilize in this scenario. Understand that this is stage 2. It's a more dangerous stage. It can also move very quickly to stage 4. So time is of the essence. So organization is everything. All right, let's do it.
All right.
So you guys have the advantage of kind of knowing what you're walking into before. I also want you to take all those learning points that we talked about from the previous scenario and use these into this next one. So if there's anything you want to talk about for just a second, right, go ahead and do it. Then we're going to walk on over here and we're going to go kind of right into the scenario. We're going to give them just a minute to go over there and get set up.